Good morning. I start in the name of Allah, the most beneficent and the most merciful. In this very short blog, we are going to talk about perianal problems. Commonest are called as hemorrhoids or a khuni bawasir and anal fissure, which is called as badi bawasir. Now, it is very important to differentiate between hemorrhoids and anal fissure or khuni or badi bawasir. Hemorrhoids are those problems in which when you go to the washroom or you pass motion, there is bleeding. Or sometimes when there is bleeding, something comes out of the intestine to the outside, and either it goes back or it has to be pushed back by hand or fingers. So this is hemorrhoids. If they are not bleeding and only something is coming out, this is not hemorrhoid. It's called as normal physiology or functioning of the body. As for the badi bawasir or the anal fissure, the important symptom which is present is that when the patient goes to the washroom and he passes motion, there is extreme degree of pain. The pain is so intense and that the patient doesn't want to go to the washroom for days. So he gets constipated, and once there is constipation, there is more pain. Both these conditions are treatable. For anal fissure, there are few medications also available, few injections, or a very simple operation. Patient comes in the morning and goes in the evening, goes back home, and the problem is over and the cure is done. If the patient is not fit for surgery or not willing for surgery, then for anal fissure, we can give either tablets or local creams or even injections locally. That also works, like injection of botulinum toxin. As far as hemorrhoids are concerned, there are 4 degrees: first, second, third, 4th-degree hemorrhoids. Now, the classification is done because the treatment of this is different. I have worked in Pakistan and abroad, so what we have come out as a conclusion, consensus developed by many of the world's leading surgeons is personally for first and second degree hemorrhoids, which are early stages, we were just under normal conditions without any anesthesia, we will apply a band. It's called as banding of hemorrhoids. It can be done in the outpatients. It can be done in any room which has a privacy, and the patient goes home, and after a while the patient is cured. As far as third and fourth degree hemorrhoids are concerned, now these are those hemorrhoids which will not only bleed on passing stool, but they also come out. For these kind of hemorrhoids, the latest modality of treatment is THG, total hemorrhoidal or transhemorrhoidal dearterialization. They have a small kind of a gadget which they put in the body, and then it has ultrasound signals. We pick up the veins or the blood vessels or the inner cushions like a spongy tissue, and we just apply 1 or 2 or 3 stitches, and the cure is done. This is very specific. So THD, banding. For injection, the injection of hemorrhoids, banding is a better procedure, so one should avoid the injections. And similarly, the classical operation, which was done for many decades, the St. Mark's classical excision and ligation, where you make incisions around the bottom, they are extremely painful. So as far as THD is concerned, or the ultrasonic identification and ligation of hemorrhoids, this is totally painless. The patient can come driving, get the surgery, stay for one day, and without any wound or external problem, he can drive back home. So this is the message. Whenever you have blood in the stools, or whenever you have something coming out while you pass motion, or whenever you have pain or we have pain while we pass motion, we must consult a doctor. Being a surgeon doesn't always mean that the surgeon is going to perform a surgery. We are not hungry for surgery. We have done enough. And the enough that we have done were also on merit. So personally, a surgeon is a person who for first 5 years of his life knows what to operate. And then for the next 20 years, he has to learn what not to operate. So most surgeons like myself will not always like to operate. We treat not only the disease, but the humans as a whole, whole human being, the spirit, the soul, the body, the mind. So going to a surgeon doesn't always means operation. If the surgeon is wise, it also means that he can give you medications, other modalities of treatment, sometimes counseling, lifestyle modification. So do go to a consultant, a doctor, or a surgeon when you have these problems. Thank you very much.